evening. The organizing committee, I thank them for having me here and giving me an opportunity to stand before you to present a topic in the state conference. Respected moderators, distinguished delegates, I think the topic that is given to present before you today would be, I will be touching upon the ethical guidelines for biomedical and health research. My presentation would be based on the following words, a few words of introduction based on the historical aspects, ethical principles involved in research, what are general principles that we should consider, and what is the role of the Institutional Ethics Committee with regard to the ethical aspects on the modulation of the research. As we all by this time try to agree, research is one of the most controversial thing that medical field also is going to be involved. And in light of the background of the different things that we have discussed so far, the terms are also fitting in a similar way. We also come across risk, we come across benefit, we come across ethics, we come across all other different aspects where there is no trust, or some of the research findings are controversial, some of them are causing harm to the subjects and all those things. So with these few words, with these few words, I try to go. I think if we have just to look at the historical aspects of important aspects of conduction of research in the past, if you see, Louis Pasteur initially tried, he wanted to have the rabies vaccine on himself. Later he gave it to Joseph Mischer, a 9-year-old boy who is on the verge of dying due to rabies. Later, experiments were conducted in the World War II on prisoners of war, where they have been immersed in tanks of ice water infected with diseases like malaria for studying the natural history of the diseases. They have been exposed to different harmful gases like mustard gas and other instruments of warfare, and also twins were separated. These are all the things that happened during the times of Second World War, which we cannot even imagine in a modern day society. And the another thing is the another important thing that we need to focus is the syphilis experiment conducted in Guatemala, where the soldiers, prisoners and psychiatric patients were infected with syphilis without taking any concern for the purpose of studying the natural history of syphilis. And then we have the most renowned Tuskegee syphilis experiment, where a particular group of native tribes who have been suffering with penicillin, who have been suffering with syphilis, have been continued to suffer with syphilis, and the experiment carried out for a period of 40 years in spite of the discovery of a drug, penicillin, in 1947, without telling them that the drug is available, or without even considering that this is supposed to be given for them. All these things that have happened in the background and to add to this, today we are in an area where we are having something which is called the research misconduct, which can range from invention of data or willful distortion of data, or not disclosing any conflict of interest, or failure to do adequate search of existing research, even not attempting to publish completed research, are different issues where we need to understand which can be addressed to. And when we consider unethical practices in research are more common than what we are really thinking, it is only the tip of the iceberg that is exposed. In view of this scenario, is it possible for us to ban research? No, it is not possible, because research is creating new knowledge. It has to be done and it has to be controlled. So what are important requisites for conduction of research? We all have the skill and we all have the knowledge for conducting research, and it is here I just want to understand that it is ethics that is required for also conducting the research. What is ethics? Ethics is, as we know, it's a body of principles governing what is right and what is wrong. It is by derivation, it is from a Greek word ethikos, which is habit, or which is a morality, which will guide us in doing what is wrong or what is right. So medical ethics are a set of values and guidelines which would help us in making decisions in medical practice, including medical research. So the historical aspect of framing of ethical guidelines, if you see in 1800s, hardly there are any guidelines for ethics. From 1940s to 1980s, there are large-scale unethical experiments that have been carried out. And in the early emergence of 1980s, if we see, there have been certain guidelines that have been started to be framed for research. Some of the earliest things which are known already, I just want to make a mention that the Nuremberg Code, which we will talk with regard to the human rights, and the Belmont Report, where there is ethical principles and guidelines for protecting of human subjects in research during the 1970s, and then we have the Declaration of Helsinki, where ethical principles for medical research involving human subjects. These are all few main documents which tries to give us certain guidelines. If you have just gist of the things, according to the Nuremberg Code, research should be based on prior animal work, and it should be justified by anticipated benefits. Physical and mental suffering must be avoided, and only qualified scientists must conduct research, and voluntary consent is absolutely essential for taking of research. Declaration of Helsinki. Declaration of Helsinki promotes medical research with a therapeutic intent for discovery of new drugs or for curing patients, and all journal editors which are supposed to publishing research can be performed in accordance with the Declaration of Helsinki, and it also made a mention of having a institutional review board to guide and regulate the research that is being conducted at different institutions. And then the Belmont Report, it focuses on four important principles. It gives voluntariness for participation. It talks about justice and equality, and it will also talk about what are the benefits that the research is going to give to the participant, and we shall not at any point of time not do any harm to the participant. So these four principles must basically be met in the process of conducting research, is what they reported. In India, the regulatory body or the guidelines that are proposed would be by Indian Council of Medical Research. They have a different set of guidelines, and the latest guidelines have been approved in 2016 and they are enforced from 2017. The guidelines, the gist of the guidelines I will try to touch upon. As I already told, ICMR also conforms to the ethical principles, that is the four things: autonomy, equality and non-malfeasance. Autonomy or respect for persons is we have to treat individuals as independent human beings, and we have to give the option to choose for themselves. We shall not by any force or by any unlawful method try to include them to be involved in the process of the research. Provide extra protection for those with limited autonomy. Those people who are not able to take decision for them, they are supposed to be given more protection with regard to insane or with regard to children or other people. And it is here the informed consent or respect of privacy is very, very important in following this. We have to always consider what are the harms and what are the minimize the harms and maximize the benefits. This is where we try to give a risk to benefit ratio, and we have to have a best possible design which can maximize the benefits, and only capable trained researchers can perform the procedures for research. Justice, treat people fairly and design the studies so that the burdens and benefits are shared equitably. We shall not discriminate with regard to the subject selection just because of their socioeconomic status, just because of their poverty or different aspects, and avoid exploitation of the vulnerable populations like migrants, like prisoners, like refugees, or whoever are there, who are easily accessible. So the important general ethical issues that we need to take into consideration are as I have just now tried to cover, benefit risk assessment, informed consent, ensure privacy and confidentiality, distributive justice, payment for participation. If at all any harm occurs with regard to the research, the compensation also should be clear. Any further care which is needed as a part of the side effects that occur because of the research, whether any conflict of interest is there, selection of vulnerable people, engaging the whole community, and post-research access and benefit sharing. Whatever research has been done, it is also always to be made a point that such research must be made publicly available by way of getting it published, so that the community academia will be knowing what exactly has been done, including the side effects or why it has not been carried on forward. The informed consent, in this regard, the informed consent document is a very, very important thing. It should ideally contain the important things. Why it is research? This is not the procedure consent that what we are taking. It is not for treatment. This is for the purpose of including them for research. What is the purpose of this research? What is the method? How long it is going to take? What is the benefits of to the participant, to the community, or any others? What are the risks? What are the inconveniences that can be caused? How confidentiality of the records is going to be ensured? How we are going to do? Is there any payment or reimbursement for participation? Treatment or compensation for injury? Freedom to participate or withdraw? Identity of the research team and contact person. So these are minimum things which should be there in a informed consent document, which we are going to proceed with regard to a research. There are 12 general principles of research which we are going to consider upon one by one. The first one is the principle of essentiality. Research on human subjects must be carried out only after consideration of all alternatives. When there is no other way, there is no other method available, we have to consider human beings as subjects for participating of the in the research with a purpose of advancing knowledge and benefit for the human beings. Principle of voluntariness and informed consent, we have already seen. It applies to the whole community as well as to the member who is a subject of the research. For example, we are involving a study from a particular community. We have to see that it is not, we cannot take it as a blanket community,